The flood, which witnesses likened to a tsunami, broke through two ageing dams on September the 10th after a hurricane-strength storm lashed the area around Derna, a port city in the east of the country. The Libyan Prosecutor General, in the meantime, has ordered the arrest of 8 officials as part of his inquiry into the recent flood disaster, which, as we see there, has killed thousands. But grief is also turning into anger as days go by. Joining me now from Tripoli in Libya is Ahmed Zouiten, a representative of the World Health Organization in Libya. Ahmed, first of all, what is the situation like on the ground 2 weeks on?
Yes, thank you very much for having me on the program. I visited Derna 2 days back with a team from WHO, and we were able to see the magnitude of the damage. It is a crisis beyond the crisis. It's a catastrophe of epic proportions. You would not believe. Nobody could believe this until you see it with your eyes. People have lost their homes, their cars, their belongings, their lives, their loved ones. Everything was washed ashore. And the magnitude of the catastrophe is really visible once you are on the ground. I don't think videos or pictures could describe the horrors that we saw in Derna. But also, there's numbers that are floating, since the start of this crisis. We know that there's 4,255 deaths that were confirmed, and also about 8,000 or 8,500 that are still missing. This magnitude is beyond what Libya knows, and there's a big number of survivors that are today suffering, especially from mental health and psychosocial trauma because of the loss they had. So with the team, we saw the priorities as first restoring the primary health care for people to access the normal health care. Also restoring the referral and restoring secondary care, having access to psychosocial support and also to mental health. But one of the things that is quite important is that the population needs a lot of support. Everywhere you go, you see that hospitals have been either destroyed or had their assets missing, or at times they are only partially functioning. 63% of hospitals are only partially or completely non-functional. 52% of primary healthcare centers are either non-functional or partially functional.
Just given the number of decomposing bodies, given what you've just been explaining, this is clearly a massive public health crisis for Libya.
It is a massive crisis overall, but I don't want people to think that because of dead bodies, there is epidemic diseases in the area. We, as WHO, have reassured the population and the international community that dead bodies do not transmit disease unless they were carrying those diseases prior to the crisis. If the body died out of Ebola or cholera or something like this, it's possible to contaminate the water or to contaminate the environment. But this is not the case for Libya. It is definitely an environmental crisis, but so far, we still do not see any emerging diseases. There are some normal cases of diarrhea, and it's about the normal expected numbers, but we don't have yet, and I hope never, any epidemic-prone diseases starting in the region.
Given that Libya has had warring factions fighting each other for years now, how difficult is it at this point in time for aid organisations to operate on the ground?
Being in Derna, I've seen something that is really reassuring. I've seen Libyans from all the spectrum of Libya come in to support. I've seen trucks with inscriptions on them coming from Tripoli, from even beyond Tripoli, coming from the south, coming from everywhere. This crisis has brought all Libyans together under one banner is to try to help as much as possible and to alleviate the suffering of people in the east. We have perfect coordination with the authorities in Tripoli, and we are also able to provide the support side by side by all the teams, our partners, the health authorities, and everyone.
What will be the first priorities for those aid organisations?
I can clearly speak of the health sector and restoring functionality of primary health care, secondary care, and providing also mental health and psychosocial support is a priority. But in over the coming few weeks, one of the emerging need is the reconstruction of the health sector, reconstruction especially of primary health care, reaching the hard to reach areas, trying as much as possible to ensure referral for people who have chronic diseases or who need normal consultations. I think the health sector has suffered a lot during this crisis, and we have to do everything hand in hand with the authorities, with our partners, so we can rebuild the health sector as soon as possible.
Ahmed Zouiten from the World Health Organization, thank you very much again for your time.
Thank you very much.